Okay, so we have a patient who's here for a laceration. The first thing I'm gonna do is grab her ID and insurance card, give it to my receptionist to register her. And while she's being registered, I'll take her back to the room for my provider to look at it first. Just in case there's like anything emergency, we have to go from there, but we do need to get a quick registration and vitals on my patient. So let's just pretend that she is here, being seen by the provider. Provider came and looked at her finger and she said, go ahead and clean it up and set it up and we'll have it ready for sutures. So before I do anything, I grab some vitals, identify myself to my patient, make sure she's in ease, ask her question regarding allergies, medication. After I'm done with the proper protocols, now it's time for me to clean and have it ready for the provider for laceration, for stitches. The first thing I did, got my gloves on. I'm gonna move this, clean it, because the provider said to have it ready to put some suture on. So I'm gonna clean it and then have the sterile fields ready for my provider. All right, you ready, Ellen? Yeah, another pen. Oh no!
I'm bleeding.
So there's blood in here. I'm not gonna throw this in the garbage. That's gonna go to my bio. And right after I'm done clicking that, I'm gonna grab my patient's finger and start cleaning it with some sterile water, because we did confirm that she does not have any allergies to anything. It's gonna be a little bit. There's my water. Gonna spray some water here, making sure we got everything out the best we can. How are we doing?
Perfect.
It's not hurting?
No,
You just said it was really hurting.
not as much.
Not as much. Yay! Few rinses in here. Usually fingers do bleed, but since this is only food coloring, of course there's not coming a lot of blood out. Just gonna pretend that's bleeding so you can clean it one more time. And now that I'm done cleaning with sterile water, I'm gonna make sure to clean it with some more swabs here. So the proper way of cleaning with swab is that we're gonna make sure that we start from the circle and work our way out. We're not gonna come back to the clean area that we just went. Usually we do about 3 swabs on each side. All right. And I'm gonna set up a sterile field that just touched, but I'm just gonna pretend that didn't touch it. Clean my hands, get a new ready. So we have a non-fenestrated and a fenestrated. Fenestrated means that it has a kind of a hole when the provider wants to set up a sterile field. It's as sterile for them as we can. Non-fenestrated means there's no hole in it. So what I'm gonna do is I'm gonna grab this, and I don't wanna touch any of this sides other than the corner. So I'm gonna grab the corner, lift it up, and I'm gonna have my patient lift their arm up, please. All right, here we go. And you can go ahead and put your arm right on that. Rest on that, thank you. And then I'm gonna get my fenestrated one. Same thing in here. Gonna make sure I'm touching only the corners. Grab it. We're not shaking this too hard. And as you can see, there's like a hole in there. I'm gonna make sure to equal that area to this injured part and have it a sterile field ready for the provider. If I can grab this side, there we go. Oh, you can put it down.
Oh, okay. Put it through the hole.
Yeah. And I'm not reaching over, because if I reach over, that's not gonna be a stereo field. Gonna come the other side, fix that to the best. Okay, and now the provider will come in, have their instrument, and put stitches down. Right after the stitches are done, the provider tells us to go ahead, clean that, put some bacitracin in it, and wrap it. Okay, so this is all done. I don't need this anymore, so now I'm gonna go ahead and clean it. If it has blood, goes on the biohazard, but since there's no blood, I'm just gonna throw that in the garbage. I'm gonna get some more of my stereo water that I have here, and very gently gonna clean this. Okay, now that I'm done cleaning with that, the provider did say that I can put some bacitracin, so I have an applicator, and I have a bacitracin that is an order by the provider. Gonna grab some of my bacitracin and put on the staples or sutures that the provider put. Now I need some more, so I'm gonna throw this away and grab a new one. Get some more and put it everywhere that I need to. And once I'm done with that, now I can go ahead and put my stereo pad on it. Depend on the size, there are different sizes. The reason that we put this is she just got some sutures in, and this is a plastic, so the plastic is not going to stick to it. This is a little bit bigger for the finger, so I can roll it if I want, or I can cut it as well. So I'm going to put this right here. Can you put your finger right there for me?
Where?
Other one. Just
Oh.
hold it. I know you're all injured, huh?
Yeah, sorry, I'm getting special treatment.
There is different kind of wrapping this, so we can get like a gauze, or we can get a bandage based on the injury that we have. Just want to put some pressure. You don't want it to be too tight. And at the end, we're just gonna put some tape. And if you don't mind putting your finger right here one more time for me, so I can put some tape. With gloves, the tape is going to be a little bit harder, so I always cut a little bit tape prior to my procedure, so I have it ready. Or we can just put a bandage, a finger bandage as well. And all set, all good to go.